are a group of organizers that volunteer to come in and help you get an opportunity to have pitch practice for entrepreneurs, started by the Kauffman Foundation in Kansas City, Missouri. Is anyone here for the first time? Oh, awesome, welcome. We're glad to have you. We have a sign-up sheet in the back. If you want to put your email address, you can keep up with our presenters that we have every week so that you can remember to come and see who's going to be next.
Try the microphone.
Which one? Do I need the microphone?
No, it just works now.
Oh. Hello, we have a mic. That's too frightening. I'll say this for the next guy. Do we have any announcements of things coming up this week? But thank you for that.
I have an announcement. I'm doing a workshop, and we're going to be making a sign, Texas state flag sign out of wood. And the proceeds from that are all going to go to benefit the flood victims in Texas.
Wow. So how are we connected with that?
Just go to our Facebook page, Woodfellas, and
Woodfellas.
see that on our Facebook page. You can buy tickets, $35, and then whatever the proceeds are going to be donated to the victims. So it's going to be an outdoor event Sunday from 12 to 4.
Whereabouts?
On Bird Neck Road, our shop.
Bird Neck Road. Just go to Woodfellas Facebook page,
Yes,
and you'll get all that information.
If you're out of town this weekend, can we still donate? Or do
Yeah, there's a place on the thing you can actually make a donation.
Okay.
From an organizer standpoint, we have a new organizer working with us, Julian here. So just want to introduce him, and if you've got ideas, suggestions, let Karen, Barak, myself, Julian know, and we're just here to hope everybody be successful. So.
Awesome. And I have one other announcement to make, just as a future note. We are going to hold 1 million cups on at Old Dominion on the 27th of September, which is 3 or 4 weeks away. So keep that in mind. I'll remind you every single week. We'll send you emails. But it's going to be at the Strom Entrepreneurial Center at Old Dominion University. So far we have one presenter that's lined up. His name is Blake Taylor, and he has a 3D printing business. So and he's a student, so it's pretty cool. So any more announcements? Things happening this week? Okay, so we have Matt Silver here to talk to you about home health interactive technologies. I get the words mixed up. It's all yours.
Do you want to dim the lights? Is it better with the lights down to see this, or no?
I'll let you know when you're a minute ready.
A minute ready?
I mean, no, to the 6.
All right. All right, thank you. Thanks so much for that great introduction. I appreciate it. All right. The name of our home health of our company is Home Health Interactive Technologies, and it's an online scheduling and information application that we have developed, and we have the provisional patent for it, which is a pending patent over the next 6 to 8 months. So basically, the why of why we're doing this web-based scheduling application is going to be because we have a 55 and older population, which is the fastest growing aging group that is using smartphones today. 74% of Americans aged 50 to 64 and 45% age 65 plus have a smartphone. So these are just some numbers that kind of resonate with. Right now, 85, 90-year-old patients' minds, sure, maybe 1 out of 10 may use a smartphone successfully, but grandchildren and children actually do. I'm going to take this off because it's bothering me. So.
Oh, okay.
All right, my voice is loud enough. Yeah. All right, so 34% of Americans age 65 plus have a tablet, and 75% have a computer. So with those numbers in mind, as we, the baby boomers age and they become more needy of home health care, they are going to want to get information through their smartphone or any kind of tablet device. And in home health care, we schedule typically about 5 to 6 patients per clinician to have a successful productivity rating to be able to get out, depending on the radius we're covering mileage-wise. And we do it in 2-hour windows. So for instance, if I have Miss Smith, I would schedule her between 8 and 10 in the morning, my next one between 10 and 12, and so forth. So we need a system that's going to be able to not only convey that successfully to patients, but have them be more transparent. Because right now it's done by just calling, it's done by texting sometimes, and the texts are fine, but we have to be careful because when we start getting into patient names, and if their granddaughter or son were to say, you know, divulge any healthcare information, I know it's innocent and it's not really, you know, there's no HIPAA violations that are intended to be broken. But HIPAA violations will be broken if you put down that Mrs. So-and-so has this cardiac issue and her date of birth is this date, and God forbid if their social security number is being shared through like a regular text message. So this web-based application will be entirely HIPAA compliant, and we're setting it up that way as we move forward. 73% of all American households also have a broadband Wi-Fi service. So the premise is, we're not there yet, but most grandkids and children are going to be able to access this for their loved ones, and it's going to create more transparency between the home health care agency and the actual patients themselves. Easy online scheduling for patients and easy scheduling coordination for home health care medical provider. The first bullet point here is that we can send an email or text confirmation for reminders of appointments. So it's going to go through our web portal, but it will send an SMS message through a secure link to their text, as a text message. They can go into it, and they'll take them right into our portal, or an email that'll just send an email out, and it'll actually say, you have an email from our either Equilibrio Home Health, whatever home health company, through this web portal, and it'll show you right to the interface where the scheduling is, what therapist or clinician's coming out. So it will specify who the person is, even have a picture of them and their credentials. So they'll know, you know, who else is coming to see them. GPS location services. It will be able to show GPS location. We are not going to be tracking our clinicians. That's not what we do in the healthcare profession. It's not like an order up. It's a similar premise. We're going to be able to send updates. Your therapist is 15 minutes away, 30 minutes away, or they're running 30 minutes behind, an hour behind. There'll be one-stop clicks that a therapist can use to voice the reasoning. If they're going to be more than an hour late, expect a phone call is usually the model that we're going to be using for that. But we want to make sure we keep it simple and straightforward. We can track therapists or clinicians, but we choose not to because of the professionalism, unless there's an issue with fraud. If we feel there's fraud going on and the government wants to get involved, we can do that. So patient and family portal will allow access to view patients' therapy progress, exercise programs tailored to each patient, which has a snapshot capability. The scheduled appointments and comments, patients and family members will be able to add comments regarding their sessions as well. Physicians will be able to access and log into the portal and sign off on orders, check status on patients, and give feedback as needed. And ratings will also be sent to the patient and family through the contact email that we're using as their contact number or their phone number, so that we can send a Google or Facebook rating so they can rate us on those two. We can use any kind of rating system, but I like to use Google and Facebook. So ratings basically will be sent through those two intermediaries. The HIPAA compliant, this is going to be a HIPAA compliant application entirely. So let me go to the next slide and show. This is the login portal, and it shows where the user ID, we're going to use the patient's user ID and password to get in. So that's the way, with our home health agency, this is our logo. So this would be a logo if another agency wanted to buy or rent the application. We can have their logo put on there. And it would show the upcoming appointments. So what we have here is this would be the view of the patient, where they can see the 2-hour window they're scheduled, and the clinician, in this case Sheila Cooper is an occupational therapist, Maria Sullivan is a PT, and we have the different 2-hour windows. We usually do 2 hours. We can do 1 hour if the patients are really close together. Requesting appointments, patient can say, the Tuesday between 8 and 10 doesn't work for my mother because she's got a cardiac appointment, put in the date, time, and then message. Can we change that to a later date? Not saying that we can always do that, but at least this is creating interaction, putting the patients and patients and their families involved into more of the care, and more of what they have to, you know, feedback-wise, to be part of the interaction. Patient information, this is more what the patient sees to enter their information so they can be in the system. What the therapist would see as far as when we have a schedule, who's going in and when, and then their address. and then we have the GPS location. So once we do see a patient, you hit the start route button. It'll take you right to the patient's home. The next slide I don't have on here because that's the end of it, which I do have in my binder, shows if you're going to be 15, 30 minutes or an hour late. And it gives a little caption, if it's more than an hour, expect a phone call. So, but this is basically what a therapist would see and how the window blocks would be color-coded with the disciplines at the top. And you can see it, you can use map directions here. And then appointment, if it's complete, you tap complete, so it calculates it. So that's, in a nutshell, first time I've ever done a presentation in like 6 minutes. That's really, I could go on for a half hour.